All right, let's get started. Thank you. Welcome, everybody, to this webinar, How TelePrEP Can Transform Your HIV Prevention and Care Delivery. This webinar will be recorded. It's in recording process at the moment. We are just a couple housekeeping notes for you all. We are in Zoom webinar presentation mode. So that means as an attendee, your video is going to remain off. Your microphone will stay muted during the entire webinar. You will see a Q&A button at the bottom of your screen, and that is where you have the opportunity to submit questions during the presentation. We'll make note of those as you submit those, and then at the Q&A portion at the end, we'll do our best to address all the questions that are submitted. If you want to submit a question anonymously, you do have an option to check that as a box before you click send. We are very excited today to bring to you Dr. Jennifer Peña. We are going to go ahead and introduce her to you. The team members from our covered entity partners are joining us for a discussion about how together we can navigate the opportunities, challenges, and crucial considerations associated with PrEP, as well as leveraging that to promote sexual wellness and the destigmatization of HIV prevention. Leading us today with actionable insights from the front lines is Dr. Jennifer Peña. Dr. Peña is a board-certified internal medicine physician who has demonstrated an unwavering commitment to patient care throughout her career. Before transitioning from active duty service in the U.S. Army in 2019, Dr. Peña served as a White House physician during both the Obama and Trump administrations, and as a primary physician to the Vice President of the United States. With expertise in digital and telehealth, Dr. Peña is currently a medical director for Care Plus, an Avita Care Solutions company that offers telehealth access without stigma, utilizing technology to deliver compassionate care and eliminate health barriers. Additionally, she's a physician consultant for URAC, a fellow of the American College of Physicians, a member of the ACP Digital Health Advisory Group. The ACP is representative on the American Telemedicine Association's advisory group in eliminating healthcare disparities and inequalities, and a member of the Puerto Rico Telehealth Working Group. Without further ado, I'm going to hand the floor over to Dr. Peña.
Hi, thank you so much, Mary, and good morning, good afternoon for everybody who's joining, and thank you for the privilege of your time today. I'm really, truly grateful for this opportunity to share some insights and lessons learned in the front lines, as Mary said, about PrEP and TelePrEP services. And I really hope it proves useful to you as a reference as you think through these programs and services within your organizations. So as you heard, the majority of my career was spent in the military. And I'll be honest, I didn't do HIV care. I didn't have PrEP care experience in the military. But in the last 4.5 years outside of the military, working in the telehealth space, including platforms focused specifically on sexual and reproductive health, it has been transformative for me and taught me a lot about the huge need that we have in access to healthcare gaps, especially in PrEP in this country, PrEP and HIV care. And it has motivated me to innovate on these models of telehealth to help address these needs. So without further ado, let's dive right into it. Here are some bullets that we'll address today, starting off with some basic PrEP stats. We'll go into some PrEP care continuum basics, and then we'll do an overview of TelePrEP and PrEP care. So some important PrEP stats. There have been significant improvements that have been made in between 2012 and 2021. Over 300,000 people in the United States use some sort of form of PrEP. The CDC data shows that in 2020, about 25% of the 1.2 million people for whom PrEP was recommended were prescribed it. And this is compared to only 3% in 2015. So this is a huge improvement. And the CDC has called for what's rapid and large scale up of PrEP services. And what that will help with is reaching those individuals that are at high risk for infection, reducing new HIV transmissions, improving cost effectiveness potentially, because if we help achieve those economies of scale, we'll potentially help reduce that overall cost of PrEP provision, and at the end of the day, have an overall public health impact. PrEP use over time has showed, again, important to reiterate that it has been a significant increase in the number of PrEP use, increased by 20% from 2021 to 2022, and we continue to see that trend, a consistent growth in PrEP use since 2012. There are some important things to note here, though. The South accounted for 52% of HIV diagnoses, but only 38% of PrEP users. So there's definitely an access to care issue there in terms of PrEP use. And in 2022, the states that expanded Medicaid programs had an average of PrEP rate that was 1.4 times higher compared with states that have not expanded Medicaid. So that's significant as well. In terms of PrEP use by gender and sex, among all of the PrEP users in the US, 92% were male and only 8% were female. And this is significant because this is despite the fact that women comprise 18% of new HIV diagnoses. In terms of PrEP use by age, so teenagers and young adults, those ages between 13 and 24 had the greatest unmet need for PrEP among all age groups. So there's still a need there. 64% of all PrEP users were between 25 and 44 years of age. And the PrEP rate use per 100,000 people was highest in the 25 to 34 age group and lowest in the 55 plus age group, again, showing that there's still a need for those age groups that are on both ends of the extreme. In terms of PrEP use by race and ethnicity, Black people represented 14% of PrEP users, but only 42% of new HIV diagnoses. So again, there's still a big need in that particular population, as well as the Hispanic Latinx people who represented 17% of PrEP users and 27% of new HIV diagnoses, and white people representing 64% of PrEP users and 26% of new HIV diagnoses. What's interesting here, and it's near and dear to my heart because I just moved recently back to Puerto Rico, is that of the 5 states with greatest unmet need for PrEP, Puerto Rico was among them, as well as Mississippi, South Carolina, Alabama, and West Virginia. And so we still have some work to do in those particular areas. When it comes to PrEP deserts, let's talk a little bit about that. So PrEP deserts are defined as those geo areas or communities that have limited access to PrEP. And that has several implications for HIV prevention and health equity. These PrEP deserts contribute to disparities in HIV incidence because these people tend to be in areas that don't have as much access or limited access to PrEP. PrEP deserts also tend to coincide with areas where awareness and education about PrEP may be lacking, and that's actually both on the patient and healthcare provider side. And the lack of accessible PrEP services can reinforce those misconceptions and biases, and it tends to increase stigma surrounding PrEP and perpetuates the negative attitudes towards individuals that are at high risk for HIV, especially again in these geo areas of the PrEP desert. So it's important to identify these areas, address these PrEP deserts, and really focus on expanding and advocating PrEP services, education, awareness in these areas, tailor those outreach programs and engage with the community, collaborate with local healthcare providers, improve insurance coverage and reimbursement support. All of those things can help bridge the gap in PrEP access in these geographical deserts. Let's talk a little bit about continuum of PrEP care. So what is that? What does that mean? Essentially it's that comprehensive approach, right? That includes the range of services and interventions that help provide HIV prevention to high-risk individuals. So when I think about the continuum of PrEP care, I think about it as involving the following components that you see here on the slide. So it falls in a preclinical, clinical, initiation, and follow-up stages of care. So on the preclinical end, we do a risk assessment. It's that awareness and risk assessment and education. So that involves, you assess the individual's risk factors for HIV, you provide education about PrEP and HIV transmission. Once you get into the clinical stage, then you're doing your PrEP screening and evaluation. Essentially, you're assessing that individual's eligibility for PrEP, testing for HIV plus or minus other STIs, kidney function, overall health status, eligibility for that PrEP initiation. Then you move on to the initiation stage. So if you deem the person eligible for PrEP, the individuals are then prescribed PrEP, typically an oral pill containing a combination of 2 antiretroviral drugs. And this step also includes providing information on proper medication use, potential side effects, and stressing the importance of adherence to these patients. And then on the follow-up stage, it's that ongoing monitoring and support. This isn't a one and done deal. Once on PrEP, these individuals require regular follow-up visits for that ongoing monitoring and support. And this may involve things like more regular HIV or STI testing, monitoring for that kidney function while they're on these prescriptions, assessing adherence, and addressing any side effects or concerns that the patient might have. And this follow-up also includes risk reduction counseling. We have to encourage people to adopt and maintain other risk reduction strategies in addition to PrEP. So things like consistent condom use and correct condom use to prevent other STI acquisition, regular STI testing, and overall reduction of those risky sexual behaviors that place them at risk. In terms of adherence, when we think about PrEP, adherence to PrEP barriers and facilitators, the way that I think about this in my brain is that bridging the barriers are the equivalent of how you facilitate PrEP adherence. So we can talk about them in this way. When I think about this, knowledge and access is probably the first barrier. So a lack of knowledge, misconceptions about PrEP, these things can affect adherence. And so it's essential for people to have accurate information on PrEP. It behooves us as clinicians to make sure we're educating and raising awareness. And these things are key to addressing misconceptions and to maintain adherence. Access and affordability, it goes without being said. I mean, I think most challenges in accessing healthcare in general, affordability is a big issue. And we have to make sure that folks have access to facilities, that they have abilities to obtain prescriptions, that they can afford the medications, that if they have issues with insurance coverage, we can help them through that. If they have financial constraints, we can give them resources. We talked a little bit about geolocation as well in the deserts. Make sure that if they don't have something close by, we can help them find their nearest clinic that can help them, or a TelePrEP service that can service them. So all of these things can impact adherence, and we have to find ways to improve that access and affordability. Stigma and discrimination, again, stigma surrounding HIV and sexual health, fear of judgment, discrimination, all of that can discourage people from openly discussing PrEP use or desire to use PrEP and seeking those services. So we have to reduce stigma and create supportive environments. Side effects and tolerability, presence of side effects can be disconcerting to people. So making sure we expectation manage with our patients, let them know what to expect, and let them know that most of these side effects are temporary and that very adverse significant effects are rare. And so as healthcare providers, we can help address these side effects through appropriate patient support and education. We have to develop good relationships with our healthcare provider-patient relationship, because open communication and trust, goes without being said, is the most effective way that we can influence adherence. And we have to do it as providers in a way that is non-judgmental and supportive to our patients. So if I had to summarize what my key messages to my patients about PrEP would be, is emphasize that PrEP is safe, and it is effective, but it is effective only if you use it consistently and correctly. So again, adherence is important. And so we have to make sure that patients understand that, and that it doesn't work immediately, right? It takes a little bit of time to kick in. And so we have to make sure that they stick with it, emphasizing the importance, again, for other prevention strategies, making sure that they use condoms regularly, that they test for STIs regularly, as other preventive measures. HIV testing, we're just coming out of HIV testing day recently. And so it's important for regular HIV testing while you're on PrEP. And that routine testing essentially is going to help us make sure that patients remain HIV negative, and it allows for early detection if those breakthrough infections do in fact occur. Again, side effect, we talked a little bit about this. And safety, ensuring that people understand what they might feel, that these side effects are mild and most serious side effects are rare. And regular healthcare visits, stay on track. We have to encourage people to keep a regular cadence of follow-up while they're on PrEP. And this is important for a myriad of reasons, but this monitoring allows us also to do more education, answering questions, and continue to do appropriate screening. Two other messages that I add that are not on this slide, but I thought it was important to talk about, is if you have patients who are pregnant or planning to become pregnant, it's important that they understand the implications of PrEP and explain that PrEP can be used safely during pregnancy, and it can help protect the baby against HIV transmission. And this is very important to emphasize with that community. And partner communication. I think it's important for us as providers, again, to encourage open and honest communication with sexual partners about PrEP use, HIV prevention, and that requires, mutual support and shared responsibility in the prevention of HIV. So TelePrEP, let's talk about TelePrEP. What does TelePrEP mean? So it's the provision of services remotely for PrEP using telehealth technologies. And it really can help improve traditional PrEP in many ways. I think most importantly, it helps with accessibility and convenience, right? I mean, TelePrEP is helpful for people who are remote areas, in underserved areas, people who have limited access to healthcare facilities close by to them. It does help reduce stigma and privacy because people sometimes will tell you that they feel a lot more comfortable discussing their sexual health and PrEP needs in a private, secure telehealth environment than it is in the comfort of their home, instead of going into a brick and mortar environment. It does help with timely care and continuity because TelePrEP allows for more timely initiation of PrEP care, and it enables folks to maintain regular follow-up visits and prescription refills in a convenient way through these remote consultations. And so it also can help with cost savings. We'll talk about reimbursement in a little bit, but it does reduce the need for in-person visits, transportation, taking time off of work, and all of these commitments are cost savings to people. And we'll talk a little bit about this as well in the workflow implementation, but telehealth consultations can actually be a lot more efficient for scheduling patients, so that allows healthcare providers to see more patients and be more cost effective that way. So it's important, though, to know, right, that TelePrEP is not a panacea. It won't always be a perfect full replacement for all in-person visits or clinical services. But as with most other telehealth modalities and telehealth services, it can complement traditional models very well, and it offers an expanded access and convenience to people. So this is just a quick slide here in terms of how do we think through the key aspects of how do you access TelePrEP. Oh, next slide here. When we think about that care journey for patients, we think about it, in a way where the patient comes in, gets an initial assessment, and gets scheduled for a consultation. That can be done through video, phone, text-based consultations, or a hybrid of those modalities. And providers can then assess those individual risk factors, discuss PrEP eligibility, and address any questions or concerns. Then laboratory monitoring and testing can be done remotely, or it can be ordered to be done at a brick and mortar lab. And these test results then can be discussed, and the provider can discuss follow-up recommendations. Then we get into the prescription medication management, where the provider can electronically send these prescription refills. These can be sent to the individual's preferred pharmacy or mail order. And then we follow up and monitor. Again, providers can then check in on the patient progress at some sort of regular established cadence. We evaluate for medication adherence. We discuss concerns, questions, and adjust the plan of care as needed, because not everybody's journey is the same. And so that adjustment is important for care continuation. So in the next slide here, we have just a couple of examples of TelePrEP programs in the United States. There's various types of TelePrEP programs. All programs leverage technology platforms to provide remote access to PrEP services. Some of the common types, as you see here, you have your national companies that focus on PrEP, TelePrEP programs that are part of hospital-based systems, state-run TelePrEP programs, and lab companies that provide TelePrEP programs with those home self-collection kits for labs. Next slide. So I think it's important to take a moment to talk about pharmacy providers and how they complement TelePrEP programs. And it's very important for many reasons, because pharmacy providers tend to have a broad presence and they can help optimize that access. Obviously in convenience, because they have such a robust presence across the country. They can also help with adherence and patient support. There's nobody better than our pharmacists to help on counseling patients on side effects and adherence, and help with prescription insurance questions, things like payment assistance programs. They tend to be the subject matter experts, and they can help patients with this. Again, it helps expand that geographical reach of prevention services to a broad population, because pharmacies are ubiquitous across the United States. It's important too that those pharmacies can collaborate with the healthcare providers, prescribing providers, the PrEP clinics, because that way is how we can ensure a comprehensive, coordinated care approach for these individuals that are using PrEP. Next slide. So TelePrEP, it's not perfect, all right? It has challenges, and with challenges, it has potential solutions. Obviously, it can offer numerous advantages, which we've been talking about already. But here's some of the challenges, right? The first and foremost is limited access to technology. I've been joking around with our team that I'm in Puerto Rico when it's raining, and I might lose Wi-Fi in the middle of this. And so one of the main challenges is ensuring that individuals have access to the technology and the smartphones, the computers, to participate in these telemedicine visits. And so we as organizations and clinicians have to be creative so that we're inclusive and we provide inclusive solutions and alternative options to people who might not have these technologies. So you might have to leverage phone consultations for some people versus Wi-Fi based. if there's a need and there's no access to internet services. Digital health literacy is huge. I mean, some people might have limited familiarity or comfort with telemedicine platforms. And so we have to make sure that we provide user-friendly interfaces, clear instructions, and educational material so people feel confident in using these technologies. We have to stress confidentiality in telehealth, especially as it relates to sexual health and PrEP, making sure that we have secure platforms, encrypted platforms that address these concerns. Physical examinations, lab testing. Sometimes we do have to leverage in-person visits, but TelePrEP can help with that coordination with local clinics to facilitate those in-person components. Medication access, we talked a little bit about this. We can be timely with PrEP prescriptions through TelePrEP, but we have to collaborate with our pharmacy counterparts to make sure that those prescriptions are being filled on time, efficiently, and coordinating for local pickup, sometimes when people need to, or at-home mail order services deliveries as well. Inadequate reimbursement insurance coverage, right? We're still dealing with a lot of reimbursement issues for telemedicine services. And so some providers face that challenge in receiving the appropriate compensation. So we have to be advocates for equitable reimbursement policies and collaborate with payers to establish what those coverage guidelines are going to be. And at the end of the day, again, it goes without being said, establishing good provider-patient relationships can be a little tricky in telehealth. So we have to teach our providers also to engage in active listening and provide a clear communication so that we can make these telemedicine visits as friendly as possible. Next slide. So a couple of things that we have to address when you're thinking as an organization of implementing a telemedicine and TelePrEP program. So TelePrEP programs require all the way from the top, organizational leadership, change management, readiness, and workflow techniques to be able to integrate appropriately. So when we think about readiness assessment, as an organization, you have to look at your organization, see how ready you are to establish a TelePrEP program. Do you have the appropriate tech infrastructure, the staff capacity, licensure, demographics? Do you need training? What's your patient population going to be? And then there's legal and regulatory requirements. You have to make sure that your leadership is engaged and that they're bought in to start a TelePrEP program. And they have to be involved in that strategic planning and decision making. There has to be a coalition between the clinical part of the organization and the rest of the leadership in order to be successful. You have to, have a good strategy plan, a good roadmap for that TelePrEP integration. Define the goals and KPIs and stick to them, and make sure that you're monitoring outcomes. You have to determine what's the scope of your telepractice, what's the modality of care that you're going to choose to use, what's your target patient population, and again, establish achievable timelines and keep yourself in check and monitor that progress. This one I have to mention because this one tends to be a touchy subject across telehealth platforms in general, but you have to foster good collaboration and cross-functional collaboration, especially when it relates to technology, IT, product teams, and clinicians. This is an essential relationship in TelePrEP programs, because so much of the product and IT support is crucial for appropriate care delivery. So we have to make sure that we teach these teams how to translate engineering into clinical speak and vice versa, and that can be challenging, but really very rewarding as well. Provider training, we have to train our providers. We have to be comprehensive in our training. We have to have clear care algorithms and guidelines, teach website manner, and that's hard to teach sometimes if you haven't done telemedicine. Foster mentorship programs, peer-to-peer learning opportunities. Like one of my fearless leaders and colleagues in our organization loves to say, PrEP is easy. And I'll say, if I could be trained to do it, anybody can be trained to do it. So let's be clear with our algorithms. Goes without being said as well, regulatory and legal compliance. I cannot stress this enough, especially in a post-PHE environment. We have to have a strong compliance cohort that can ensure that we're compliant with relevant regulations, because these are state by state and they are changing very rapidly. So we need a good regulatory and compliance cohort that can stay updated with federal, state, local regulations as it relates to your programs, telehealth, privacy, security, reimbursement, all of these requirements are very important. And so you need to also evaluate again and make sure you're evaluated for continuous improvement. And that doesn't only mean program effectiveness and patient satisfaction like NPS scores. That means clinical outcomes and quality. And we have to make sure that we're doing good quality assurance assessment. And what I like to say is data drives outcomes. So make sure that you have a platform where you can access data, access it easily, and access it continuously, so that then you can make and implement adjustments that are necessary on a continuous basis for process improvement. In terms of workflow changes, here are some of the workflow changes to consider when you're implementing TelePrEP. Appointment scheduling is super important for both patients and providers. Make sure you're adjusting the scheduling system to accommodate telemedicine visits. I say provide tech time because glitches happen. Consider virtual waiting rooms to make sure people have sufficient time to maneuver across the platform. Send appointment reminders, to reduce no-show rates. Send pre-visit instructions for easy access to the platform. These are just some tricks to help with the process. Do tech checks, check connectivity speeds, make sure people can log in. It's amazing how much more efficient and frictionless things can be if you follow these easy steps. Have a good seamless intake and registration process. As we like to say in the military, keep it simple, stupid. Make sure this process is easy and streamlined. Collect data ahead of time of the appointment, and maybe patient self-reported registration, or maybe have somebody like a medical assistant help you collect some of that registration information ahead of time. You have to have good documentation of record keeping. You need a good electronic health record. You need an easy way, templates to document. Tools like dot phrases, macros, make things easy for providers to document these encounters. And actually all of these like templates will help with quality, because with templates, you can ensure that all of those important visit components are there and are documented, and it makes the process more efficient. And again, telehealth platform, make sure your EHR is integrated. Aim for less clicks is what I say. Click reduction for providers. Make sure platforms are easy. Aim for consolidation and integration. You don't want your providers to have 5 platforms open. You want to try to consolidate and integrate those platforms. We talked already about pharmacy collaboration and prescription, ordering program. What I would say about this in TelePrEP is make sure you have a good e-prescribing software that's integrated into your EHR platform. That's going to be the best way to coordinate with your pharmacies and make sure that those prescriptions are being filled adequately and in a timely way. Same with laboratory. Make sure that you have good established lab workflows, that you collaborate with those local laboratories or self-collect options at home, and make sure that those are done, that specimen collection is done seamlessly. Make sure you're communicating and documenting test results and state mandated reporting when needed. Next slide. So we'll end by saying that, there's obviously implications for health equity when it comes to TelePrEP. And even though TelePrEP does help us address health equity gaps, it also can exacerbate them if we're not doing this correctly. So some of the stuff we've already talked about, but you have to make sure there's access to technology, because telemedicine relies on technology. So let's make sure we're not creating more barriers for individuals. If they don't have these resources, let's leverage phone or other solutions and be creative. We have to make efforts to address that digital divide, and it's on us to make sure we're exploring options for our patients and providing that support. We have to ensure digital health literacy. Don't miss an opportunity to educate your patients. Leverage social media, TikTok, blogs, videos, use influencers, step-by-step guides. These are all examples of how you can improve that literacy divide. Cultural and linguistic considerations. Anybody who's worked with me or works with me know this is my passion project. We have to be culturally and linguistically appropriate so that we can accommodate diverse populations. Hire diverse staff, train on cultural competency, use language interpretation services. All of these things will help with that. Make sure you're not forgetting your marginalized and stigmatized populations, people with substance abuse disorder, ethnic minorities who face additional barriers and stigma when seeking PrEP. And again, we should make sure that we're tailoring our services to these populations. Don't forget that socioeconomically, some people might not have coverage for TelePrEP programs. Let's make sure we explore alternative payment options for these individuals. Build that trust and relationship with your patients, because at the end of the day, fostering good communication and relationships with your patients and providers is what's going to help you succeed. Next slide. So in summary, really quick, again, take home considerations for a successful, mostly successful TelePrEP program. Access and equity, equitable. We have to be equitable. Technology access, digital health literacy, cultural sensitivity, all the things we've talked about. Good technology and infrastructure, private, secure, good, seamless for providers and patients. Train your providers, train your patients, coordinate workflows, get leadership support and buy-in, and make sure that you have a good legal and regulatory compliance, and don't forget your quality assurance, as well as your collaboration and partnerships. Always continue to strive to improve. I think these key components will help you and your organizations develop and implement a good TelePrEP program that's efficient, patient-centered, at the end of the day, aligned with the main goal of improving HIV prevention and access to care. Thank you so much. And all right, what we'll do is we'll open up the floor to some questions, and keep in mind that if we're not able to get to all your questions, I can reach out to you directly with more information, and we'll include all of the questions in the recap blog, which we'll publish shortly. And you all will get an email with a link to the recording today. Thank you.
Thank you, Dr. Peña. And thanks everybody for your attention to today's session. We do have some questions coming in. We're going to start with this first one about the implications for different modalities of TelePrEP care, asynchronous versus synchronous, especially in this post-pandemic landscape. Dr. Peña?
I love this question because the PHE just recently ended in May. And since then, even before then, but certainly since then, there's been a lot of changes happening, not only in TelePrEP, but in telemedicine care in general. And so, I think I'll start by saying that the first important thing to do is, as an organization, again, pick which modality serves your patient population and your provider population best. So choose a model that you're going to implement. Follow some of the steps, obviously, that we just discussed, but pick your model. And it could be a hybrid model. And in fact, I would argue that you should allow for fluidity and flexibility, because in my experience, hybrid model tends to offer the most comprehensive services. And when it comes to TelePrEP, since we know that it not always can all be done completely remotely, you should strive for a hybrid model. And again, hybrid also in terms of the communication technology, because again, if we have people who don't have access to internet, we might have to leverage phone services. Check on the state-by-state regulations. I think I've said it several times, but I cannot stress this enough. Every state is different, and every state has its own regulations in terms of what's deemed appropriate and acceptable for telehealth delivery of care. Some states still require synchronous, so live encounters with the patient. Other states don't. Other states require synchronous encounters only a certain amount of times, or at the initiation of the telemedicine encounter. And so make sure that you understand in your states or the states that you operate in what those regulations are. And again, equip yourself with a good legal and compliance cohort and function. Think about what the pros and cons of your organizational and business model goals are. If you're a business that wants to scale quickly, you might want to look at asynchronous models of care, because those allow for quick scale. They also allow for good data and metrics to be captured and analyzed, because it's all in an async way that can be captured. Make sure that you have, again, a good EHR, electronic health record, that's integrated, and what the tech implications are for your providers as well as your patients when you choose the appropriate EHR. There's one that comes up a lot, which is, is this an application-based only program, or is this a web-based only program? And what are those implications for web parity? All of these things are things that, again, at the organizational leadership level, you have to think about when you're thinking about that model of TelePrEP that you want to implement. And finally, make sure that you don't forget, things we talked about in terms of being inclusive and diverse sensitive, language competency implication. Say, for example, if you're doing an async model of care only, then in terms of language, translation, that has certain implications. If you're doing synchronous visits, then that has a different, translation, interpretation, language implication. And so again, those are just some things to think about as we're thinking how to navigate this post-pandemic TelePrEP landscape.
Lots of great guidance there. Thanks, Dr. Peña. There's another question, shifting gears a tiny bit. What does self-collection for labs look like? Is it generally accessible and easy for patients to do?
Also a great question. There has been so much work that has gone into groups and companies that are doing self-collection lab tests. And it's actually really wonderful to see. Again, I'm personally biased because I think that kind of service is so needed in my particular geographical desert where we don't have as much access to brick and mortar labs. And so, a lot of these devices, come for, again, self-collection. The patient themselves can do it at home. There's different ways that those labs can be interpreted. I'm not going to get into the nuance of it, but they can be, blood spot or other modalities. But traditionally, the patient will get a kit in the mail. It'll come with instructions on how to collect the sample. then that sample is repackaged and sent back to a laboratory that processes it. And then those results are translated back to the provider that ordered the prescription. And if you remember the clinical continuum of care, then that provider can reach out and connect to the patient to review those results. So it offers a great way for patients to have an alternative to monitor labs at the home, labs that are needed for PrEP initiation and monitoring. It allows for, destigmatization, because the patient might not feel as apprehensive as having to go into a brick and mortar lab to get, labs that are required for PrEP. And again, it's just a great way to truly bridge the access to care gap, especially in care deserts where those laboratory services are not readily available.
Thanks, Dr. Peña. This question sticks with kind of that same line of thought about patients and motivations. The question is, what would motivate a patient to access PrEP via telehealth instead of brick and mortar clinic? And are there particular traits or demographics that make a patient a better candidate for telehealth?
Yeah, that's the perfect seg, because a lot of it is similar to what we just discussed, exactly with the self-collected lab option. So, when it comes to what motivates people to access PrEP via telehealth and TelePrEP platforms versus visiting a brick and mortar, first is convenience, right, and accessibility. These TelePrEP programs offer people the ability to do this from the comfort of your own home or any location, as long as you have internet access. It avoids that need for travel and parking and missing work, waiting in crowded clinic settings when you potentially, as a patient, are already feeling a little bit apprehensive in going in to get sexual health and PrEP health care. This is beneficial, for people who have busy schedules, limited mobility even, and again, people who are living in remote or underserved areas that don't have a lot of healthcare facilities accessible. Privacy and confidentiality, actually, TelePrEP is great for that too. And people who are looking for privacy, again, you can do this very discreetly as they're discussing their sexual health and PrEP needs. So people who are uncomfortable having those sensitive topics, face to face with a provider, this is a great confidential environment to do that. But basically, at the end of the day, it can actually enhance engagement with patients and providers, because especially, say, for example, if you're an async model of care, where it's not real time, sometimes patients actually are more active, interestingly, in participating in their own care, because they can go back, think about whatever the recommendations the provider gave them, research them, and come back with more questions for the providers. And so sometimes that communication is actually improved and fostered with these types of modalities of care. And it can actually also improve continuity of care. So people seeking, continuity of care, because you can have more touch points via telehealth when you don't have to miss a day of work to go into the clinic. And so, you asked about particular traits or demographics that make people a better candidate too. People who are tech literate, obviously, might be more comfortable in using these technologies. But that doesn't mean that people who don't have the technology literacy can't be taught to do it. Again, you need access to the internet. So obviously, having consistent access to the internet will make people more amenable to coming in and trying TelePrEP services. And at the end of the day, there's need. If you don't have, clinics or healthcare facilities next to you, you're certainly more prone to look for other alternatives that are advantageous to you if you're in a rural area, remote area that doesn't have any other, means of getting that care. So those are just a few of the considerations.
Great discussion. And I think we've got time for just a couple more here. You had mentioned earlier the importance of cultural competency. And there is a question that's been submitted here about asking you to speak to the role of provider cultural competency when it comes to making patients feel comfortable with taking PrEP and adhering to it long term.
Yeah, so again, something that is a passion project of mine when it comes to cultural linguistic competency. And when I think about what that means, to me, that refers to our provider ability to truly understand and respect cultural beliefs, values, practices, diversity of practices in the populations that we are serving. And that doesn't mean that we need to know them. That means that we need to be open to learning about them. And that overall is going to contribute to building patient comfort and adherence to PrEP, which is what we're trying to do. So, by thinking about it this way, you recognize that building that trust is important. And it creates an environment where people, patients, but also providers feel heard, respected, and valued. It helps address stigma and discrimination too, because it helps providers recognize that their patients might have fear, due to their sexual orientation or gender identity. They might not be as willing to share, high-risk behaviors. So if you validate their backgrounds, you talk to them in their language, you communicate in a way that helps reduce those barriers for them, that's going to help you with PrEP uptake and experience. And they're going to feel like they're in a safe space. And so, it's important for organizations, as you're thinking about your TelePrEP services and cultural competency and how you train your providers, to make sure that you are coming up with a tailored communication and education. So don't be generic. It would be my recommendation, right? Make sure that you're truly giving thought of, as you're strategizing for your programs, who is your patient cohort that you're trying to hit? Who are those communities that you're trying to address? And make sure that you make a concerted effort to have cultural context when you're coming up with patient education, patient materials, and when you're hiring your staff and you're training your staff. Yeah.
Thank you. And this is a related question, but on a higher level, big picture, and this will be the last question we have time for today. There is a desire to ask you to address the recent CDC report that shows that the rate of new HIV diagnoses is down, but that Black and Latinx patients are falling behind in this trend. So how is PrEP outreach to patients facing racial disparities crucial to the overall national effort to end the HIV epidemic by 2030?
And so, we talked a little bit about that throughout the presentation, all the way from the statistics where there's still a disproportionate incidence of HIV cases in racial minorities like Latinx, and Black populations who have lower, use of PrEP. And I think that, a lot of the things that we talked about throughout the presentation address why that is. If you look at geographical deserts of care, and I'm going to talk about this generally, I don't know for sure exactly, which geo areas, but for certain here, I can speak to that, here in Puerto Rico, there is a lack of access to care. There are lack of PrEP services, brick and mortar and TelePrEP, the same. And so when you look at those geodeserts, a lot of times the populations that are more prevalent in this geographical desert tend to be of these, communities. So these, racial minority communities. And so I think everything that we've talked about in terms of trying to improve access to care in those geographical areas where there's less presence of health, institutions and health clinics will inevitably lead to an improvement in getting these communities better care. Also, again, what we just talked about, cultural competency. Again, I'll speak perfect example right here in Puerto Rico. Spanish is the predominant language, and there's a cultural bias against HIV care and PrEP care. It's very prevalent. And so it's going to take a lot of education of the community, and that starts at the provider level. Our providers have to, get that cultural competency and then help translate that into our patient populations. And so there's other ways, of course, that we can try to mitigate for that, but I think those two should definitely get the ball rolling in terms of improving those numbers.
Thank you so much, Dr. Peña. The information that you've shared and the clarity of the messages you've been able to convey, I think, is really valuable to everybody on this session. That is unfortunately all the time that we have for today. We really appreciate everyone making time to be here. Remember, do check your email for a recording of today's session, and look for an upcoming blog that we'll put out with addressing any of the further questions that came in. And we do invite you to contact your strategic account executive with more questions if you have those. Thank you so much, Dr. Peña, for joining us here today, and to all of you for tuning in. Have a wonderful day.